Nursing 201 Case Study 2, Trinity, Brylee, Jessica, Emma, and Lisa.
Jenny Smith, a 40-year-old female, presents to the emergency department with abdominal pain that began in the periumbilical area, but has since moved to the right lower quadrant. She has extreme nausea and a lack of energy. No relevant past medical history is present. Is this visit urgent or non-urgent? As nurses, we need to prioritize patients by severity of the problem. A first-level priority involves any patient with impairment of the airways, breathing, or circulation, any cardiac or circulation problems, vital sign concerns, and any lab values that are life-threatening. A second-level priority for nurses would be patients with changes in their mental status, untreated medical problems, for example, a diabetic who hasn't had insulin, any pain and urinary elimination problems. A third-level priority would be any health problems that don't fit into the first two categories, such as activity, rest, family coping, and a lack of knowledge. This visit would be considered a second-level priority. This is because it is not immediately life-threatening or involve impairment of the airways, breathing, or circulation. In this case, it would be considered a second-level priority because Jenny is experiencing acute pain and extreme nausea, which we would need to address promptly. Since Jenny is experiencing symptoms of pain, nausea, and a lack of energy alongside an increased white blood cell count, we would need to intervene in order to prevent further deterioration or infection. History of present illness. Onset. Jenny started out with diffuse, vague abdominal pain and lack of energy that started 2 days ago. She is experiencing extreme nausea that started tonight, but no vomiting. Appendicitis typically starts with a pain in the middle of the abdomen that may come and go, but within hours the pain travels to your lower right-hand side, where the appendix is located, and becomes constant and severe. Location. Jenny's pain originally started in the periumbilical area, but tonight it has moved to the right lower quadrant. She is experiencing nausea alongside her abdominal pain. Duration. Jenny has been experiencing pain for 2 days alongside a lack of energy, and her extreme nausea only started tonight. Character of her pain. At the onset of Jenny's abdominal pain, she characterized it as vague and diffuse, but on the second day, her pain moved to the right lower quadrant. She explains that she has extreme nausea. Alleviating or aggravating factors. In this case, it is not stated what factors are aggravating or alleviating, but in appendicitis cases, some aggravating factors include palpation or pressure on the right lower quadrant, McBurney's point, palpation of the left lower quadrant, Bloomberg or Rosswing's sign, activation of the psoas or obturator muscles, coughing or walking. Some factors that may alleviate appendicitis pain include rest and supporting the abdomen when coughing. Radiating. Jenny's abdominal pain started out in the periumbilical area and then the next day radiated to the right lower quadrant, and now she is feeling nauseated. This presentation is typical of acute appendicitis cases. Any treatments tried? It is unknown with the data provided what treatments have already been tried by the patient to relieve her abdominal pain or nausea. Since this information is missing, it would be important to ask Jenny what she has done to try and relieve the pain, and if any over-the-counter medications have been taken. Severity. In this case, the severity of her abdominal pain is unknown, but her nausea is stated to be extreme. In order to have a thorough examination, we would need to conduct a pain assessment, PQRST, to determine the severity of her pain.
So, risk factors within the case. Risk factors that are present and are directly related to the patient in this case include the patient's age, elevated levels of erythrocytes, nausea, waiting to seek care, and a lack of interest in regard to food. Family history is not relevant in this case study, but appendicitis has been known to run in families. The notion that appendicitis is familial is not only important for understanding the etiology of the condition, but might contribute substantially to the diagnosis and provide an indication for an early surgical intervention. What disease may be present if pertained? We believe the patient within the case suffers from a form of acute gastrointestinal disease. In specific, we feel the patient is experiencing acute onset appendicitis. Social history of the case. The case has little social history noted. However, questions regarding social history that would be beneficial to ask the patient are alcohol consumption, if so, how often, how much, type consumed most often, illicit drug use, if so, what, how often, how much, reliance or other patterns of use, diet patterns, how often the patient cooks, how often the patient orders out, and what a regular meal looks like to them, physical activity patterns, so how often do they exercise a day, a week, and the type of exercise, sleep patterns, how many hours a night, is it a broken sleep or insomnia, and stressors and forms of stress relief. What are questions we would ask the patient? We would ask the patient if they were experiencing any irregular bowel patterns, if they have been experiencing any fever or changes in their temperature, if the patient's pain gets worse when coughing or taking deep inhalations or exhalations, if the patient's had any prior abdominal surgeries, if they've had problems with their appendix before, and if they have a family history of appendicitis.
So 2A, B, and C, since a patient has a complaint about abdominal discomfort, we will want to assess this area mainly. So some of the physical examinations we can do is auscultation, percussion, and palpation of the abdomen. While doing this physical assessment, some red flags may be any guarding, any pain, also noting any masses or tenderness, and also noting if any brutes are present while doing auscultation. So some additional tests we will want to do only if time allows would be performing the special tests. So first, rebound tenderness to make sure there's no peritoneal inflammation, assessing for any possible signs of appendicitis using Rossvine sign, psoas sign, obturator sign, and also McBurney's point tenderness.
Vital signs. I have provided a chart at the bottom of the slide for an easy side-by-side comparison of the expected values for an adult and the values given within the case study. Looking at them side by side, you can see right away that the temperature was not provided within the case study. The temperature is an important value to note, as a heightened temperature would signify the presence of infection. All other vital signs provided are within normal range, apart from the patient's blood pressure. The patient's blood pressure would be considered elevated, as the systolic pressure is above 120 and the diastolic pressure is lower than 80. Relevant screening tools. The nurse would use the numerical pain rating scale by asking the patient to rate her pain on a scale of 0 to 10, 0 representing no pain and 10 representing the worst possible pain. The nurse would then use the Alvarado score to assess the patient for the likelihood of acute appendicitis. I've provided the Alvarado score for our current patient on the right-hand side of the slide. The Alvarado score uses the presence of migration of pain, anorexia, nausea, tenderness in the lower right quadrant, rebound pain, elevated temperature, leukocytosis, and the shifting of the white blood cell count to the left for a score out of 10. The temperature and whether or not our patient is experiencing rebound tenderness are missing, but based on the information currently provided, our patient would score 8 out of 10. Looking at the recommendations on the bottom of the slide, a score of 8 means that appendicitis is likely.
Right, so interpretation of laboratory findings. The urine beta HCG was negative. Urine beta HCG is a test that looks for elevated HCG levels, which is indicative of pregnancy. If a woman is pregnant, her HCG levels will increase rapidly. Since the patient reported abdominal pain and nausea, a urine beta HCG test was administered to rule out a possible pregnancy. Her urinalysis was within normal limits. A urinalysis is used to test the patient's urine for a variety of different medical conditions. This test looks at the content, appearance, and concentration of the patient's urine. This lab was ordered to help rule out any medical conditions and help come up with a diagnosis. The patient's urinalysis was within normal limits, but that does not mean the patient does not have a medical condition. There are many different factors that could yield an incorrect response, or it may be too early to detect the condition. White blood cell count was 11,500 cells per microliter. Normally, white blood cell count should range from 4,500 cells per microliter to 11,000 cells per microliter. The patient's white blood cell count would be considered high. This test was ordered to check if the patient was fighting off an infection. Elevated white blood cell count, which was our patient's result, indicates her body may be trying to fight off an infection. Her red blood cell count was within normal limits. A test to check for red blood cell count would be ordered to see if the patient is dealing with any blood-related medical conditions. The patient's red blood cell count is within normal limits, which indicates there are most likely no blood-related issues going on. Are there any point-of-care laboratory assessments the nurse can complete without an order? After reading and consulting the BCCNM registered nurse scope of practice, I did not see anything that suggested a registered nurse is allowed to order any laboratory tests without a listed health professional, which includes dentists, physicians, midwives, naturopaths, podiatrists, pharmacists, nurse practitioners, and certified practice nurses. The only test I read about that a nurse can order themselves is an X-ray or an ultrasound, as long as they follow the professional standards and have additional education. In the patient's case, I would suggest ordering an ultrasound or an X-ray. The patient complains of abdominal pain, so an X-ray or ultrasound may be able to tell the doctor if there are any abnormalities visible in the abdomen. Top 3 nursing diagnoses. Acute pain related to inflammation of the appendix, as evidenced by abdominal pain in the lower right quadrant. The patient started off experiencing pain in the periumbilical area 2 days prior to admission to the hospital. The pain has since then migrated to the lower right quadrant, which is indicative of appendicitis. Risk for infection, as evidenced by elevated white blood cell count. The elevated white blood cell count we saw in the patient's labs is indicative the patient is at risk for an infection or the body is already trying to fight off an infection. Nausea related to pain, as evidenced by verbalization of nausea. The patient stated she is in pain and experiencing nausea but no vomiting. She also is experiencing a lack of appetite.
So the key features of the exam would be rebound tenderness, rose vein sign, psoas sign, obturator sign, and McBurney's point tenderness. So SBAR report, S, this is blank calling from the emergency department. I have a 4-year-old female patient complaining about diffuse vague abdominal pain in the periumbilical area. She had reported that the pain moved down to the right lower quadrant and has extreme nausea, but has yet to vomit. B. Vital signs were all normal except for systolic pressure, which was slightly elevated, and an elevated white blood cell count. She is not taking medications and has an allergy to Septra. A. We believe she is experiencing acute appendicitis. R. I recommend that you come in and assess this patient and also order more pain medication for this patient.
For the documentation, the abdomen is soft, non-tender times 3. Tenderness is present in the right lower quadrant. Bowel sounds are active times 4. The patient is experiencing pain in the periumbilical area. The patient is experiencing a lack of energy. They're experiencing nausea and an elevated white blood cell count. They're normal voiding, and the blood pressure is 138/70. The pulse pressure is 80. The oxygen saturation rate is 99, and the respiratory rate is 17. The urine beta HCG came back negative, and the urinalysis is normal. The patient was left resting comfortably in bed.